for joining us for the latest installment on the Food Service Guidelines Networking Call. We are very excited to have you here today, and I'm very excited about the panelists that we have to join us on the call. This is Julie Ralston Aoki, and I am with the Public Health Law Center based here in St. Paul, Minnesota. And the co-hosts this afternoon are Katie Bishop with the American Heart Association and Tony Ellis with the Center for Science and the Public Interest. And as many of you know Katie from her former life at CSPI, and so we thought this would be a great opportunity for Katie to talk a little bit about her new position at Heart, as well as for Tony to introduce himself. But before we get to that, I just wanted to say that the guest speakers or presenters for this afternoon are Kinari Chandriani, who is a food procurement specialist at the Philadelphia Department of Health, and Robin Hedrick, who is Director of Healthy Kids, YMCA of the Greater Twin Cities. They're both going to be talking about some really interesting healthy vending programs and policies that they've implemented within their respective organizations, and just share some of their experiences and lessons learned from those implementation experiences. And as always, we will open it up for questions and discussion after the presentations. And I believe that we'll be asking folks to use the chat function to raise their questions. Is that correct, Tony?
That's correct.
Okay, thank you. So if you have questions, whenever you think of them, please feel free to put them into the chat window. And so I guess we'll go from there. Katie, do you want to start by just introducing yourself and your new position?
Sure. Hello, everybody. So as you know, Julie, Ashley Bell, and I used to run these calls. Ashley Bell has moved to a different position within the Heart Association, and I have taken over her old role. So I am now the State and Community Obesity Policy Manager with Voices for Healthy Kids and the Office of State Advocacy at the American Heart Association. And one of the topics that I will still be working on with AHA is procurement and food service guidelines, as well as a few other nutrition and physical activity policy areas. So I'm really excited to still be able to do these networking calls with all of you. And now I will turn it over to Tony to introduce himself.
Hello, thanks for joining us today. My name is Tony Ellis. I am relatively new to CSPI and have some big shoes to fill. I'm actually taking over some of the work that Katie Bishop was responsible for working on, technical assistance and answering questions from some of the advocates across the country. So it's a pleasure to meet you all virtually via WebEx, and looking forward to the information that's going to be shared today.
Great, thank you, Tony. So with that, without further ado, I would like to introduce our first speaker. Again, it's Ms. Kinari Chandriani, who will be speaking, who is a food procurement specialist at the Philadelphia Department of Health, and will be talking about a really great, comprehensive healthy vending and food policy and program that the city has been working on. Tony, do you want to cue up her slide?
Great, thanks. Good afternoon, everyone. Thank you to AHA, CSPI, and PHLC for having me on this webinar today to share more about our work in Philadelphia. Next slide. During my presentation, I'll give an overview of Get Healthy Philly, discuss how the comprehensive food standards were developed in Philadelphia, and then discuss our process for implementation. Next slide. To start with some context, the Philadelphia Department of Public Health launched Get Healthy Philly in 2010, envisioning a Philadelphia where all residents can live, work, learn, shop, worship, and play in environments that promote healthy eating, active living, and a smoke-free existence. And of course, all of that to help ensure that Philadelphians can enjoy long, productive lives that are free from disease, disability, and premature death. Our goal is really to make healthy choices accessible and easy. Next slide. Many Philadelphians live in environments that make unhealthy choices the default. And so changing the food environment involves a multi-sector approach. So what you see on this slide are all initiatives of Get Healthy Philly working to ensure that communities across Philadelphia have adequate access to fresh and healthy food options. I won't go through each of these today, but in addition to working in all of these settings in the community, we also wanted to ensure that healthy choices are available within city government and through city programs. And so that was really the impetus for developing our citywide nutrition policies for city departments, which will be a focus of my presentation today. Next slide. Next slide. Oh, sorry, back one, please. Thank you. So each year, the City of Philadelphia serves over 20 million meals and snacks to almost 64,000 individuals, including some of our more vulnerable populations. This is an incredible opportunity to change the food environment right here within our city government. So we started with our healthy beverage and snack vending standards, which went into effect in 2011 and 12, respectively, and were incorporated into the then existing contract through amendment. And then in 2012, one of my colleagues conducted an initial survey of city departments to gather basic information about their programs, their food service models, their food budgets and contracts, and so forth. And at that time, the team started the process of developing the nutrition standards. So our standards are based primarily on the 2010 dietary guidelines, as well as the standards of New York City and Massachusetts. And as our standards were being, we shared drafts of the standards with city departments that would be impacted by them in order to gather their input and feedback. So that entire process took some time, and last summer, in June of 2014, our mayor signed an executive order formalizing the comprehensive food standards, stating that all food and beverages purchased, prepared, or served in connection with a city contract must comply with the nutrition standards, and that they must be a part of all new contracts going forward. So as you'll see on this graphic, the standards are divided into sections on purchased foods, meals and snacks served, nutrients, vending, and then there are also best practices on meetings, sustainability, and concessions. And then each of these sections has required and recommended standards. And you can see everything in more detail at our website. So just a few examples of the city departments and programs that are impacted by these standards are our prisons, our summer and after school programs, juvenile detention center, out of school time programs, shelters, sheriff's office, and many more. Next slide. So next I'll share our process for implementation. So first as I mentioned before, we started outreach even prior to the executive order being passed. And since then, we've continued to build on those connections, and we meet with individual departments to introduce the standards and talk about implementation and next steps. For our city departments who contract out their services, including food service, to outside provider agencies, we were able to also get on the schedule for their all providers meetings and present an overview and introduce the standards to all of their providers as well. We also hold 2 times a year interdepartmental meetings where we gather all impacted departments together to share updates and progress. We also ask our departments to share menus and nutritional analyses with us. And in some cases where departments don't have the capacity, our team helps with conducting the nutritional analysis. And then we provide feedback on department menus. So next, in order to help track where departments are with respect to the standards, we ask that each completes a self-report form going through each of the standards in the purchased foods and the meals and snacks served sections of our standards, and they have to indicate whether they're currently meeting the standard or not. So last year, we asked all departments to complete a baseline report, and the plan is to ask each department to complete the same report each year in order to track progress. This type of form is also helpful with goal setting. since everyone can then see the areas where changes are still needed in order to work towards meeting our standards and can help prioritize those. On this slide, you'll see a snapshot of that self-report form that I just talked about. And then finally, we're working to institutionalize our standards through contracts. And that's happening on an individual level with departments where we offer to review contracts and provide recommended language. And it's also happening on a broader scale where we're working with our finance department to include standards language as a part of the RFP template. And we're also working with our procurement department to help make sure that we're flagged for any food-related bids that are coming through that we might not already had input on. Next slide. An important part of our approach has been to provide resources and support to departments to help facilitate implementation. I'll go through examples of a few of these resources. So first, one of the first things we developed was an implementation guide. So that goes through some of our standards, and then the rest of the guide has tip sheets in it. So tip sheet topics include things like healthier cooking methods, using herbs and spices, local produce availability, and so forth. We also provide, I think as I mentioned, recommendations as requested on the purchasing that our departments do and also on their menus. Through our 1422 grant from the CDC, we're also working with a partner community organization, the Health Promotion Council, to provide trainings on general nutrition and the food standards to city departments and programs. So they're targeted for different audiences, for kitchen staff, program staff, and constituents at city departments. And now currently we're working on designing and developing a resource guide which will be targeted for use in the kitchen with information about unit conversions, food safety, strategies for food sourcing, healthy food substitutions, and more. And the guide will also include a series of healthier recipes. And then finally, we try to fulfill any other TA requests from departments or help address other needs that are identified in this process. Next slide. So we've certainly faced challenges along the way and have learned so much and are still continuing to learn so much from our departments. So I'll go through a few of these challenges. So first, buy-in and communication with departments. We found that this is really not everyone else's primary focus and work, and also that each department has its own set of challenges that they face in terms of implementing our standards. There's also no financial support for implementation for departments. And so as a result, we found that it really requires a lot of follow-up to try to work as closely as possible with departments. So the next challenge, the first concern that's most often raised by departments is that they're worried that making healthier changes will cost more. And we're still trying to gather concrete information about how this plays out. But for now, our recommendation is always to start with those cost-neutral changes first. One concrete example that we do have is with our prisons. So they looked into whether they could start transitioning from regular bread to wheat bread and found that it would result in a cost increase of about 6 cents per meal, which actually adds up to quite a lot given the number of meals that they serve per day, per week, per month. The next challenge I wanted to mention is that our procurement bid process locks departments and vendors into 6-month contracts, which is not really an ideal structure for food procurement where prices and product availability fluctuate seasonally. And then next, unrelated to the standards, there are a limited number of vendors who bid on contracts, on city contracts, and that really impacts competition and, as a result, the quality of the food that's provided. We've also learned that some of our departments face limitations around infrastructure and storage capacity, for example, our shelters. And so they really require more shelf-stable products and less fresh and frozen foods. And so that poses a challenge as well. The next challenge, or the last challenge I have listed here, is identifying all of the contracts impacted. So our executive order is actually quite far-reaching, which is a really great thing. but it includes contracts that provide for direct or indirect city funding of food service or purchasing, regardless of whether food is the predominant component of the contract or not. And so that means we're working really hard to make sure that we're identifying all contracts that are really impacted by our executive order. And in terms of lessons learned, there are many of them, but I'll just highlight two quickly here. So one is to simplify that self-report. So I mentioned this, that we asked departments to fill out a self-report form. And I think it would be really helpful to kind of prioritize the standards that are most important to you, because it can be a cumbersome process for departments to go through every single standard. For our next follow-up, we're going to actually be transitioning our form to Google Forms in order to help with user friendliness of filling them out. And my next recommendation would be around considering including contract review as a part of the policy. So this is not a part of our executive order, and I think it could be really helpful to have a requirement that departments have to share contracts with the health department before publicly posting them. Next slide. So next I'm going to talk a little bit about our healthy vending standards. So our healthy vending standards are specified for our beverage and snack vending machines in the city. And the standards are divided into different categories, including product mix, display, placement and promotion, product size, labeling, and price. So currently, these standards impact around 390 total beverage and snack vending machines throughout city buildings that fall under our citywide vending contract. Next slide. I'll run through some of our vending implementation activities. So since the healthy vending standards were first implemented, we've since had a new contract and vendor go into place early last year. Get Healthy Philly was part of the selection process, and the standards were included in the RFP and final contract. We also work with our vendor to review the planograms to ensure that they meet our healthy vending standards. Last year, we also designed labels that we've provided to the vendor that they will be putting up onto our snack machines to indicate that there are healthier snacks in the machines, and also to identify which ones those are. Other activities, so I participate in weekly calls with our vendor and our procurement department who manages this contract. And I also wanted to mention several of the activities that we did last summer. So we did taste tests where we introduced some of the healthier options that are available in the machines to employees and more of the high sales locations in the city. And we partnered with our vendor to do that. Last summer, we also conducted a citywide electronic survey that was sent to all city employees in order to gather their feedback and some information on their purchasing habits around vending. Last summer, we were also very fortunate to have an intern who worked with us who visited 245 beverage and snack machines across the city to conduct compliance checks. And so she went to each machine equipped with compliance check forms that we developed. And on this slide, you'll actually see, again, snapshots of our compliance check forms. And so after those 3 activities that we did last summer, we gathered all the results of the employee survey, the taste tests, and the compliance checks, and we shared all of that information back with the vendor and procurement department, and that really helped to inform some of our conversations moving forward. Next slide. We also have several lessons learned which may be helpful for those who are embarking on a healthy vending program in their community. So first would be to gather employee feedback early on, because that information can really help to fuel conversations with the vendor and what you'd like to see in the machines. And next, I think there are a series of things that really could be established during the contracting process that can really help make the life of the contract a much smoother process. So first would be to require a variety of healthier products. Although our vendor has planograms that meet our healthy vending standards, they've had trouble actually providing a lot of variety. So we have a lot of the same types of products in the machines. Next, this is a great time, the contracting process is a great time to agree on planograms for snack and beverage machines and have that in place at the beginning of the contract. It's also a good time to identify the commission and pricing structure and a chance to advocate for having a preferential pricing structure where healthier products may be less expensive than other products. And finally, it's really important to try to work with the vendors that you're contracting with to determine their capacity for data collection and reporting that you'll be needing throughout this contract. Even though that's something that we had identified and required on our contract, we had a lot of trouble actually getting the reports back from our vendor. And it's taken a lot of follow-up to get that. And then next slide. I'm going to just finish up by mentioning our newest initiative, which is being led by Catherine Bartoli, and is expanding on our nutrition standards work, to the hospital food environment. So she's working with multiple partners to develop voluntary nutrition standards and local and sustainable food procurement practices to integrate into areas where foods are served and sold in hospitals. So they're targeting 5 areas of hospital food service, including cafeterias, vending, catering, on-site restaurants, and patient meals. And the first year is currently focusing on outreach, recruitment, information gathering at baseline, developing standards, and working with hospitals to get them to formally commit to the initiative. And then years 2 through 4 will really focus on implementation. So that's, next slide, that's everything that I have to share. I'm happy to answer questions later, and these are our websites that have a lot more information about all of the nutrition standards work that I just discussed. Thank you so much.
Thank you, Kenari. That was very interesting, and I'm sure that people will have some good questions for you here. So next, we'll be turning to Robin Hedrick, who is the Director of Healthy Kids for the YMCA of the Greater Twin Cities, and she'll be talking about a healthy vending policy that the YMCA is here in the Twin Cities implemented last year. Robin, go ahead and take it away.
Thank you so much for inviting me to be on this call today. I am experiencing a couple challenges, so I hope that I make it through this portion okay. I apologize if there's some intermittent challenges here. As I launched this, I wanted to give a little bit of backdrop for the YMCA of the Greater Twin Cities. We combined the YMCAs of Metropolitan Minneapolis and Greater St. Paul back in January of 2012, and we formed what is now the YMCA of the Greater Twin Cities. So with our new organization, the YMCA serves 21 full facility branches. We have 5 community sites. We have 7 resident camps, and we have 10 day camps. In addition, the Y offers more than 90 child care locations, including early learning, preschool, and school-aged. We have 3 main strategic tenets, them being healthy living, youth development, and social responsibility. Our one tenet around healthy living does focus on the work of the Y serving as a trusted resource for individuals and family fitness and nutrition. So out of that came this project that we worked on, and the first step in the project to bring healthy living to the forefront of the YMCA's operations is that we assessed our readiness. First, we had to make sure that we had senior leadership support, which in our new YMCA of the Greater Twin Cities venture, we absolutely had that moving forward. We had to look at what our existing contracts with our caterers and vending were. We were fortunate we were at a place where both contracts around catering and vending were coming up for renewal, so we were able to really reassess what it was that we were offering in those particular areas. We had to look at budget impact, so we had to really look at some of the vendor support that was being provided to us. We were receiving some sponsorship dollars, for example, to have product in our vending machines across our association. We had to look at the potential for some increased pricing to happen. A lot of times we know that with some healthier choices, prices can increase. We also had to look at our employee wellness efforts. We knew that to make this sustainable, we had to have our staff driving this and really leading the way. And we had to reach our staff to make sure that they were feeling like they had the education and information to be able to share with our members and parents that we serve in all of our program areas. And last of all, we had to define the standards that we were going to use as we moved forward in this process. Next slide, please. So the YMCA of the USA has adopted what we call our Healthy Eating and Physical Activity, or HEPA standards, and they were established by the National After School Association. And the YMCA of the USA, like I mentioned, has adopted these nationwide, and our Twin Cities location actually has come on board to implement these standards at 100%. These standards are based on research using partners such as the Harvard School of Public Health, the University of Massachusetts at Boston, the Healthy Out of School Time Coalition, and the National Institute for Out of School Time. In addition, they do align with the First Lady Michelle Obama's Let's Move campaign. And finally, we made sure that we needed to bring some of our experts to the table. We brought a registered dietitian to the table. We brought our health partners, Yum Power program, which had a strong vending model in place. Next slide, please. So our healthy eating and physical activity standards, as you can see, do include multiple areas to focus on. Food is one of those, and beverages is the second one. It is important, though, that we approached it in a whole well-being way, which means we had to have our staff role modeling the healthy behaviors. We had to have education for our parents and our providers as to why we were making some of these healthier food choices in our programs and in our facilities. And we had to make sure that our youth and our participants were making sure to also keep physical activity at the forefront. Next slide, please. So we did this project in two phases. The first phase was our vending services. So we took the opportunity to actually rebrand our vending across all of our locations where we had vending machines, and we named it Healthy Choices for Healthy Living, and we were able to work with our vendor to brand and wrap our machines so that this was something that was very prevalent to our members and participants that walked into our facilities to see that we absolutely have made a change. Next slide, please. We did move to 100% vending, better for you choices in both snacks and beverages. And we made sure that those, of course, aligned with our nutrition guidelines, which, of course, then also aligned with our healthy eating and physical activity standards. We went to the following guidelines: around 35% or less calories, total fat calories from fat, 10% or less calories from saturated fat, 35% or less total weight in sugar, no trans fats, and 270 milligrams of sodium or less. Some of our talking points are listed to the right side, so that you can see that we tried to say that we were focusing on better for you options, because we know that in not all cases some of the choices would be perceived in some people's minds as healthy, because healthy is defined differently for everybody. Next slide, please. The second phase that we really chose to focus on, next slide, was our staff. Our staff, of course, as we mentioned, were going to have to champion this and really drive this into our branches and our programs. So we had to make some decisions of how we were going to move forward with our food and snacks that we provided at our YMCA-sponsored events, meetings, and programs, and how we were going to go about following those healthy nutrition, snack, and beverage guidelines in our internal operations in addition to our external operations. We encouraged all staff, and we still encourage, and this is something that I will say is a process that we're working through still today, are encouraged to model good eating habits and will follow the healthy nutrition guidelines, again, while working in direct contact with our members and participants. We hope that some of our staff will take some of these learnings and some of the education and information that we're providing to carry through in their life outside of the YMCA when they're working in program, but the goal was to make sure that while working in front of members and participants, they were role modeling the healthy nutrition guidelines. And that we used our employee wellness team as a group to help support these efforts and to provide opportunities for training and for fun activities to support the standards. We did healthy food baskets, and we still continue to do those every quarter, where our sites get delivered a fresh grown basket of fruits and vegetables and different local options, where the site can explore what those some different recipes and taste foods and try out different things. Next slide, please. And the last phase of our phase 2, which is the one that will be ongoing for us for quite some time, is to really integrate these standards into all of our programs that serve youth. As I mentioned, we have over 90 child care sites, and we have, we're considered one of the largest providers of child care. So we also were able to roll into changing our catering guidelines to meet these healthy eating and physical activity standards. We're trying to engage and incorporate these healthy living guidelines into all of our overnight camp programs and our youth sport programs, which can be a challenging piece when we've had a long and rich history of providing some of these programs and services. Next slide, please. So some of our key learnings and pieces that I would really focus in on is to literally look at your low-hanging fruit or your natural wins. Again, as I said, we had contracts coming to a closure in both our vending and our catering, and so we were able to just take advantage of that opportunity to really refocus and relook at what it was that we were asking of our vendors and our food caterers to provide for us. We had to be flexible. We came out of the gate with great ideas that we could do HEPA standards all over, all the time. And in some cases, there just wasn't the product to support that. Manufacturers are working to, I believe, improve around this area, but they are not always having access to available foods. The vendors aren't always able to access the foods from the manufacturers. So we had to be flexible in some cases and know that we will do the best we can to provide the healthier choices and continue to process improve as more products become available. We try to pilot new products that come out in a couple of our branch locations. We do food testing with the vendor support to allow folks to try new foods to see how we can move forward and continue to meet those guidelines at the highest level. The program area readiness was another piece. Again, we have some program areas that were more ready than others. Our child care programs were a little further along in the process, as an example, because the YMCA as an entire movement has always put an emphasis around one of the critical areas being healthy eating and physical activity. Versus some of our overnight camping where we have a lot of tradition and we have a lot of foods that come along with the tradition of camping that are sometimes a little harder to have staff think about alternatives in and come up with some new ways to do things. Vending results, year one, just to share with folks, even though that this could be looked as a success or a challenge or maybe both, we did see a decrease in our total units sold to date, but we also did see an increase in our revenue. Now we know that that was due to several factors, and so that's where we're working with our vendor, because we just finished our year one where we're able to actually look at and analyze some of these data across the association to see what were some of the factors that drove those numbers. But we do know that there, for example, as I mentioned, some of the healthier choices that we ended up using in our vending have a higher price point. So we know that that would increase our revenue for us, but in some cases it ended up decreasing our total units sold. So how that relates is an area that we're continuing to dig deeper into to learn a little bit more as we continue to move forward. Next slide, and that was all that I had to present to the group, and it sounds like I'll turn it back over to Julie.
Thank you, Robin. So here we wanted to just pause for a few moments here and give people some time to submit questions. Hopefully you've been putting some questions in the chat box as we go along. And so Tony, were you going to moderate those questions?
Yes, sure. Let's see here.
While you're looking, pulling those together, let me just say thank you again very much to Kanari and Robin for taking the time to share this with us today. It's really interesting. It sounds like you guys are both doing such great work and have a lot of really valuable experience to share with everyone.
So I think there's one question here. It says, for either speaker or presenter, what kinds of employee resistance did you encounter and how did you overcome it?
So would either Kanari or Robin like to take that one?
Yeah, I can add comment. This is Robin. The largest piece of resistance that we did receive was primarily from some of our urban branches that were located in more of our urban communities that felt like the increase in price in the vending machines in particular was going to be a challenge for them and the folks within their community. Again, we haven't analyzed fully to see how much of an impact we specifically saw at some of our urban branches, for example, in relationship to some of our suburban branch locations. But that was the first, I guess, resistance that I heard coming out from some of our staff team members.
Great.
And this is Kinnery from Philadelphia. So when our new vendor for our vending came on board last year, there were a lot of changes that took place in the machines. So they pretty much changed all the products in the machines, and at the same time, they also increased all the prices. And I think what we were hearing anecdotally is that people were upset about the high prices because they were quite a bit higher than the previous vendor. And I think at the same time, people were also kind of associating the new vendor with the new prices and also the healthier items in the machines, and we're kind of mixing all that together. And so I mentioned a few of the activities that we did to try to overcome this. So one was that we held taste tests in in 5 different locations in the city, so that I guess we weren't sure whether employees were familiar with the healthier items that were being offered in the machine and wanted to give them a chance to try some of those options to know what's in there. And I think I was at all of the taste tests, and I think it was people were kind of surprised, pleasantly surprised with the options that were in there. So that was one thing. And then we also did that citywide employee vending survey to get some feedback from employees. And one of the key pieces of feedback that came through that was that people were really dissatisfied with the high prices. And so we took that back to our vendor and our procurement department, and since then have negotiated for our renewal this year, negotiated that prices would be reduced, although that did also come with a reduced commission rate for our city departments. But I think that we're still working on implementing these changes, but once they are, I think that'll help to really address some of the concerns that employees had.
Great. One other question came in. For Robin, are you able to maintain the 100% standard consistently, or do you see some products creep in there?
In our vending machines, we actually are able to maintain at the 100% healthier choices level. Where we do see a little bit of the creep in has been in some of our areas where we actually are able to provide almost sales for selling like snacks, for example, at a teen night event or at our skate park. We have seen some of those non-compliant choices creeping into that mix. We do run reports through our centralized purchasing department that does show us where those are occurring, so that we can at least have conversation back with those particular programs and or locations to revisit and find out where they're seeing or having some challenges.
Great. For our Philadelphia presenter, on the slides where you show your vending criteria for beverage and snacks, it looks like the first two descriptions on snacks are actually duplicative of the descriptions about beverages. Is this the case?
Yeah, exactly. So we just wanted to specify, since our snack and beverage machines are separate, we wanted to specify what the standards would be for each type of machine. And in terms of product mix, that was a decision that was made when developing our standards, that we were going to start with requiring at least 65% of the beverages and beverage machines should be healthy and meet our, we have a set of healthy criteria. And then similarly for snack machines, I apologize, I listed beverages, but it should be at least 65% of the snacks that are in snack machines should meet the healthy snack criteria. And in terms of the display, placement, promotion, that should also be, that's the same similar criteria for both beverage and snack machines. Does that answer the question?
I believe so. One other follow-up question. How many vending machines and vending sites are involved with your efforts?
I don't have the number of sites on hand, but we have close to 400 total snack and beverage vending machines throughout city buildings and city leased property where our employees work.
Great. Have you worked with blind vendors? And if so, how has that experience been?
This is Kinnery from Philadelphia. We have not.
Great. And it looks like we have...
We have not either. This is Robin.
Perfect. I think we have just one last question. I think this is for Philly, but I think it says, do you have any tips for encouraging vendors to bid on contracts?
So I think maybe I can give one example. So we've been sort of brainstorming and trying to understand better why there's so few vendors that bid on a lot of the city contracts. And one of our theories is that contracting with the city can seem kind of like a burdensome process, or maybe one that's not totally clear in terms of how that happens. And so I think especially for smaller vendors, that could be a barrier. So one thing that we actually did last summer or fall, we tried to hold a vendor forum. And so what we tried to do is we tried to invite all of our existing vendors, but also any vendor that was registered with our procurement department and also with our Office of Economic Opportunity. as well as any other vendors in the area that we had contact information for. We tried to sort of spread the word, invite people to this forum. And during this vendor forum, we had several presentations. So I had organized it so that our procurement department was presenting so they could share a little bit of insight about how the bid process works. We had our finance department who also presented about how our RFP process works. And then we also had our Office of Economic Opportunity present and share more about preferences for small businesses, women-owned businesses, minority-owned businesses. So our hope with this forum was really to, sorry, let me take one step back. And then, of course, I also presented about our healthy, our nutrition standards so that people were aware of the type of demand that the city would be asking for moving forward. And so our goal with this forum was really to have an opportunity where all sorts of vendors, food-related vendors, could learn a little bit more about how to contract with the city, with the hopes that, that if it was more of a transparent process, it might be something people are more willing to do. I guess the big challenge that we faced with the forum was who actually turned up for that forum. And so it ended up being a lot of, we did have some existing vendors that attended, but we also had a lot of smaller catering type of businesses attend, and those types of businesses wouldn't necessarily be able to meet some of our larger contracts. And so, I think it was useful and a good experience. So I think if you, I would definitely recommend something like that, a chance to share what the contracting process is like, make it more transparent and accessible if you have the opportunity. But I think it's really important to try to bring out the, a good variety of vendors that would actually be able to respond to contracts.
Great, and I think that's all the questions that we've received.
Tony, this is Katie. I have just a couple of other questions, and then also I just wanted to let folks know that this webinar is being recorded. We can send out the PowerPoint slides to everybody afterwards and a link to the recording of the webinar. And then for Robin, I have a question for you. How have the kids responded to the healthier products in your YMCAs?
That's a really great question. We've had different response in some of our different communities. On the vending side, of course, we haven't seen much challenges around that. It's been more with our catering contracts because that is where we're providing the food, the snacks, and the meals for the children. We have partnered with a chef. Chef Marshall O'Brien has been coming in and working with us on how to present our foods so that they taste. We focus on making the foods taste better so that we have less waste. Because I will admit that we were having a challenge, particularly with some of our urban locations and suburban locations with kids wasting and not eating some of the food. So we brought in our chef to partner with our caterer to work with coming up with some different ways to present the foods. We focused on a couple sites that were having a little bit more challenge and actually had the chef visiting those sites and doing some taste testing with the kids in a fun way, coming in a chef uniform and making it really fun for the kids. Because if you introduce fun and let the kids do a little bit of hands-on taste testing, it can really go a long way. But I think the piece where our chef worked with specifically the caterers, that was another real critical piece.
Great, thanks, Robin. And then just one last question for Kenari. Has it been challenging to make sure that the 65% is consistently maintained in the vending machines?
It is. It's still been an ongoing process. At the time that our intern did compliance checks last summer, we found that few to none of the machines were fully compliant with our standards, so that would include not just the 65%, but also these other categories of criteria. But it's been an ongoing challenge because we have a prime vendor, and then we also have, they have 2 sub-vendors. And implementing all of our healthy vending standards has really been a long process for all 3 vendors. And so, you know, for vending machines that are sort of nearby where I work, I'll try to do drop-in compliance checks and share back to the vendors because they're not always kind of at the level where they're visiting machines. So we've really been working with the vendor, with our procurement department to come together around this, and we're really hoping that hopefully soon that the machines will be compliant. But it has been really helpful to have planograms in place because then the drivers know what they should be stocking the machines with.
Great, thank you.
Can I ask a follow-up question to that?
Yeah.
I was just wondering about, how about enforcement, Kanara? How are you doing in enforcement with your vendors, or what approach are you taking?
Yeah, you know, we don't really have any kind of penalties or anything like that in place in our contract. And so enforcement has really been what we, as the health department, have been able to do on the ground level in terms of visiting machines, taking photos, and sharing all that information back with our vendor and our procurement department. And our procurement department has been very supportive of our healthy vending program and is working hard to sort of help enforce and set deadlines with our vendor around being compliant.
Thank you.
Mm-hmm.
Were there any other questions? Well, that was really great. Again, thank you so much, Kanari and Robin, for sharing that information. Here in the last few minutes, before we wrap up, we just want to cover a few things. We want to let you know about some additional resources that have come out to support this work on improving food service guidelines and procurement. So the first is, some of you, if you've heard me talk about before, you've probably heard me talking for a while about the 50-state review that the Public Health Law Center has been conducting of all the state equivalent of blind vendor laws granting or providing a priority or a preference to legally blind vendors to operate vending facilities and concessions as well as other local government property in some cases. And so I'm very glad to say that we now have the, and this was a research project that was supported by the American Heart Association. And so we're really excited now that we've been able to put some of the key findings from that research here on our website through a handy interface. It's this, here's a screenshot of the web page where you can find it. There's the web page link there on the side. I will tell you or warn you, it is actually a little bit hard to find right now. We're working on making sure there are better links in some of the other parts of our website, but it's kind of a work in progress. So I will tell you, if you search by Randolph Shepherd, it will come up, but there's also the URL there to use. So it takes you to this page, and you see the map interface there, and then you can just click on your state. And once you do that, it will take you to a page specific to your state with the information. Can you take me to the next slide, please, Tony? Thank you. And so here's an example. I chose Pennsylvania because one of our speakers was from the state of Pennsylvania. And so here's an example of what the information would look like on that page. Now, this doesn't show everything that's on the page. It's a little too long to fit on the slide, but you can see, it tells you whether there is a state mini Randolph Shepherd law. And Randolph Shepherd is the name of the federal law that grants a priority to blind vendors to operate concessions and vending on federal property. So this is asking, is there a state equivalent? And so you see the answer there is yes, and then it's what the agency is in charge of administering that law, where can you find it in the code, and where are the regulations? And then further on down, it explains like, does it apply to just state property, or does it apply to local government property as well? And then also, is there a definition of what is defined as being a vending or concession? And so if there's a definition, that's there. And then is there anything in the state law regulations that defines or sets out like what has to be in the contract with the blind vendors, and then where you can find that in the state law or regulations. And so I know Tanari mentioned that she hadn't worked with blind vendors for the Philadelphia initiative. And just one thing to note is that while the state of Pennsylvania does have a state blind vendor law, it does not apply to local government property. So that would be why most likely she didn't have to or didn't work with a lot of blind vendors in that effort. So there it is. If you have any questions about it, please feel free to call or email us here at the Public Health Law Center, and we'd be glad to kind of walk you through it or give you some more information. Next slide, please. And then we have some additional resources from Tony from the CSPI.
Certainly. And so CSPI has a host of resources available. Wanted to call your attention to a fact sheet that CSPI highlights some of the best practices with regard to successful implementation. And we've gathered this from people across the country implementing food service guidelines. In addition to this resource, we also have a model pre- and post-implementation survey that advocates across the country and folks who are implementing can use to help assess their initiatives. And lastly, I want to call your attention to a new resource. It's an infographic. You may have seen it. It's extremely helpful. It explains what food service guidelines are and why it's important to put them in place. And actually, many of these resources were created by Katie Bishop when she was here at CSPI. And if you have any questions, certainly we'll love to answer your questions now.
In the meantime, do you want to take it to the next slide, Tony?
Sure. And then wanted to call your attention. We want to make sure that it's on your radar. Our next procurement networking call will take place October 29th, 2015. And if you would be so kind as to register in advance, it gives us an opportunity to prepare accordingly for that call. And certainly we'd like to hear your feedback on the topics that you'd like to hear or presented on.
Yeah, and I would just like to add that I would also invite your feedback on the format, of these calls. We've been using this. Initially we had it more as a conference call, but there were some challenges there, as you know, if you've been on these where people forget to mute and that kind of thing. And so we kind of went to this WebEx webinar kind of format where people have to put their questions in through chat. And I know that can maybe sometimes feels a little stilted for people. So we've done it both ways now a couple of times. It would be great to get people's feedback on if they have a preference, if they think the other way was better, or if they like this way. I also invite your feedback on that. And with that, I think we are at the end of the hour. Katie or Tony, is there anything you'd like to add?
No, not at this time.
No, just thank you to both of our great speakers. Thank you, Julie, for moderating this discussion, and Tony for handling the question and answer. And we look forward to talking with all of you in October.
Great, thank you.